Good afternoon. This is Nicholas Courtney with the National Congress of American Indians. Thank you all for joining us for our fourth and final webinar on the overview of the Affordable Care Act. We will begin our webinar in approximately 3 minutes. Hello. Again, this is Nicholas Courtney with the National Congress of American Indians. We thank you for joining us for today's webinar on outreach and education best practices throughout Indian country, a part of the overview of the Affordable Care Act and benefits of AI/AN marketplace enrollment. Today, we have the distinct pleasure of hearing from Kristen Bitsui, the Tribal Healthcare Reform Outreach and Education Program Associate with the National Indian Health Board. On the line, we also have Donnig McDonough, who is the Health Systems Analytics CEO and will be answering any questions that anyone may have at the end of the webinar. First, before going into the content of the webinar, I would like to discuss and review how to best participate in this webinar. You can see that you each do not have audio access. However, to engage with us during this webinar, we encourage you all to use the questions toolbox within GoToWebinar's platform. Your questions will be answered at the end of the webinar. If you have any questions about this, please contact me directly at ncourtney@ncai.org. Without further ado, it is my pleasure to hand the mic over to Kristen Bitsui.
Hello, thank you, Nicholas, for that introduction, and thank you to NCAI for inviting National Indian Health Board to be part of this webinar series. And to start the presentation off, just want to go over an overview of what I will be presenting in this webinar. So what does outreach education mean to Indian country. And I'll go over some best practices from Indian country as I travel and do this work for outreach and education. And then share with you some story thinking stories that I have accumulated as I travel throughout Indian country. And then also be able to share some resources with you too. So let's get started here. So what does outreach and education mean to Indian country? This is something that I have picked up from one of the trainings that I had did. And, I thought it was pretty interesting how they use the word reach. And within that, they use each letter of each of the letter, or each letter from the word, and R standing for reach out to tribal members within the community, E for empower tribal members, A to advertise to inform tribal members of your program, and then C, culturally appropriate education. H is for highlight and identify tribal community needs. And if you look at that, it pretty much gives you a whole outlook of what outreach and education is to Indian country. You're, giving them as much information as possible, and at the same time, you are also giving them, resources. You're giving them information about what their health insurance is all about, and it's coming directly from an enrollment sister that's American Indian and Alaska Native. So, and then on the next slide is outreach and education responsibility to Indian country. So a lot of times what is happening is that enrollment sisters are helping tribal members enroll into health insurance coverage, and they're assisting them and going through the whole process of the application and then also submitting documentation. And then they're also giving information about the healthcare process too, which is extremely important because a lot of times some of that information is really hard to understand. So to have someone there to help them through this process and to give them that information is usually one of the responsibilities when it comes to outreach and education. And then the other thing is, giving the information on what special protections and provisions are specifically to American Indians and Alaska Native. So a lot of times what happens in this is that individuals, our tribal members, are not understanding what those protections and provisions are. So when you do outreach and education, a lot of times what will happen is that they don't understand that, maybe in Medicaid, that they don't have to pay anything out of pocket, and they're not supposed to be paid any kind of fees along with that. So it's always good to get that information out there to give them the knowledge of what their protections and their provisions are. And the other responsibility is providing education to communities and letting them know why they need to enroll into health insurance, and also what the significance of having health insurance also means, and what it does for, your IHS facility, your tribal facility, and even the urban facilities. And next slide. So let's get into some of the best practices. So a lot of times in my job, what I do is I travel all over Indian country, and I do a lot of training to front-end staff, tribal leaders, and also anybody that works with our American Indian and Alaska Native group. And so the first one I want to get into is one of the best practices that I came across, one of the communities that I went into. So what they do is they do in-reach training, meaning that they educate a lot of their internal staff, so patient registration, the medical providers, and also nurses, even the housekeeping, even HR people that are actually working in the facility, not directly in the clinic part of it, but also on the outside of it. Because a lot of times these individuals are also, they have families and they also have individuals that they're in contact with that want information of, how to apply for health insurance or what kind of protections and provisions they have. So if they work at the clinic and, most likely they will ask them, so what does this mean? I heard about this, or, on the radio, this is what they were talking about. And this particular one, they were educating everybody at the facility, not just the clinic staff, but everybody, so that they're aware of exactly what patient benefit coordinators do to help their community members, their tribal members enroll into health insurance and why it's important to enroll. And then they've realized also through this that word of mouth is probably one of the big things that they do that helps them be able to provide a lot of information across the board. So if their staff know about it, then they will tell their tribal members, or they will, speak at a tribal meeting, or even their family. So a lot of times, they come back, they get the experience of a patient benefit coordinator helping them, and then all of a sudden that patient will tell their family member about, oh, I had this great experience. This individual helped me through the whole process. All I had to do was come in, the individual completed my application, submitted all my documents, and once they got that good experience, they shared it again. So it was like a snowball where, a very positive one, you just tell one person and then it goes on and on and on. And then the other thing was they also had a really good relationship with their providers. So when a patient came in, and if the patient was uninsured, right away the providers would inform the patient benefit coordinator and to let them know that, this individual doesn't have health insurance, and, we're going to be referring this patient out, so we need to, find some health insurance for this individual. And then not just the medical providers, but also the nurses. So they're all aware of what that process is. And then the other thing this patient benefit coordinator did was also do a referral card. So if she was not available at that moment, at least the providers, the nurses, the front-end staff, meaning the patient registration, they all had referral cards of the patient benefit coordinator's contact information. So if the PBC was not available, at least they had these referral cards that they could give to them to let them know that, when you have time or you can come back. And then on that referral card also displayed a lot of the documents that was needed to complete a Medicaid application or even go through healthcare.gov. So there was a lot of education that was going on within this little clinic, and it provided a lot of information to the staff and then outside of that too. So there were some really good best practices that were happening in this, and I thought that it was really neat to see how, even though maybe they're a housekeeper, they completely understood exactly some of those protections and provisions within Medicaid or even on the health insurance marketplace side of it. So the next slide, we'll go on to the next best practice, which is a community outreach. So in this scenario, there was a facility was able to create partnership with local organizations, so that these organizations also help a lot of our American Indian and Alaska Native individuals. So as long as they understood that, we work in a tribal facility or an IHS facility, that, they have that partnership to let them know that if they have any more questions or if there's anything that you might need, to get that partnership going, or for them to refer those individuals over to the tribal hospital or the IHS hospital or even the urban side of it. And creating those partnerships was helping this particular facility on being able to to talk to them and get that information out. And also that since, the facility is the one that deal with American Indian and Alaska Native on a daily basis, and they know a lot about the process, they know, what the protections are, the provisions are, and so they were getting a lot of that referral from the local organization just because they created those partnerships. And then the second part was, the local state Medicaid office. This was pretty interesting that there are some facilities that are very, how would I say, they have a really good relationship with their state Medicaid office. So sometimes even the state Medicaid office, since they don't deal with their American Indian and Alaska Native members on a daily basis, and there are some things that are specific to our group that is very unique. And sometimes the Medicaid office would even refer some of these individuals to the IHS facility so that, a PBC, a patient benefit coordinator, would be the one to assist them with the whole process, which was really interesting to see that relationship happen between the state Medicaid office, or if there was a question that they needed, answered, and since they don't, deal with that AIAN application on a daily basis, that they would call the PBC at the IHS office and ask for an assistant. And then the other thing too was the community outreach is dealing with educational materials. So when you're doing an outreach in the community, there was a facility that, did not have the funding to get any kind of educational material side of it, like maybe printing or maybe even a color printer, or trying to create something that looked professional that they could use, and they were using the CMS educational materials for that, so that when they go out into the community, they have something to hand out to the tribal members as they are doing these outreach in the community. It could be either doing a presentation to even, setting up a booth, an informational booth at maybe there's a community, what I want to say, a community event or something like that that is going on, and they're just setting up the booth. And then the other thing is, advertising community outreach events. How are they doing this? How do they give that word out to the community that they're, going to be doing some kind of event, whether if it's a presentation, whether if they're going to be setting up a booth, or if it's going to be, some kind of maybe an outreach event. And some of the places that I went to, they were using their tribal newspaper, and they were also using tribal radio, and social media was another good way of getting these advertisements out about what they're going to be doing within the community side of it. And then our next slide is outreach strategies. So as I had mentioned, some of the presentations. So how they were doing these presentations were at different locations and at different times, depending on what is happening that month. So first of all, one could be at a tribal meeting. They could get on the agenda and be able to do a presentation to the tribal leaders to explain about, what the things that are happening, the current information, or just updating them, or letting them know that, this is what we're trying to do, and, this is what we do at the facility. So just giving that information to the tribal leaders, that was another place that they would do presentations at. And the other one was school. So this could even be at a high school, this could be at the university, the community colleges, and, during open enrollment. So right now, it's, there's school in right now too, so that's happening. And so they're trying to find ways to piggyback off of other organizations, or maybe there's an event that's already happening and they just want to get on the agenda to do a presentation about what the program is and what kind of assistance that they can provide for either college students or even the schools. Head Start is another place that that I've heard that they do a lot of their outreach and education at. And then local agencies. Local agencies, sometimes they don't work with our American Indian and Alaska Native on a daily basis, but they do see, individuals. So it's good to provide information about what the either IHS or the tribal facilities that have the patient benefit coordinator or even just the enrollment assistant side of it, of exactly what they do in their program within the facilities, and give that information out. So it's always, they were doing presentations to the local agencies. And then partnerships. And so as they're doing these presentations and they're doing all these booths, they're creating partnerships along the way, and they're, as they build these relationships, they're finding out that, oh, you know what, if there's something going on, within your department or your organization, please invite us, or I don't mind doing, a presentation to your employees, your staff, or maybe there's, a group, and that they can do some kind of outreach to. And then also maybe that organization or that the partnership that they're creating, they realize that there are some services that they could utilize. And that was there was one facility that actually had a partnership with an organization to utilize their meeting rooms, because they did not have, big meeting rooms within their tribal facilities. So when they would create this partnership so that they could use their meeting rooms. And then through these partnerships also, they were getting referrals. So they would tell them, hey, there's somebody at this IHS facility that does, an open enrollment, or will assist you with your Medicaid application. And so they would send these individuals over to them. So there was the referral process that was also happening through these partnerships. And then the other thing is the informational booth. I went over this a little bit, but this is an opportunity that a lot of the PBCs were letting me know that this is where they get a lot of their connections, and also are able to understand what is happening within their community, and maybe there's a reason why, they're not coming to their office, or maybe they heard something on the radio or the TV, and they get all sorts of information when they set up their informational booth. And the next slide. So the other thing that I do is I do site visits, and in these site visits, each area, they do their outreach differently, depending on exactly, what they cater to or what's at their disposal. Meaning that, it might be so rural that there's only one patient benefit coordinator, and, it's really hard for her to get away from the office. So a lot of times it might be in the evening, or maybe there's a community gathering on the weekend, and so the individual would go out and, do these outreach. But through the practice of outreach, it brought out a lot of information to where the patients knew exactly what the enrollment assister or the PBC, depending on, there's different titles for enrollment assisters, but through these site visits, I've realized that a lot of the information that is provided through outreach, a lot of the tribal members come back to the facility wanting more information, and it may not be right then and there that they're asking questions. They might sit on it a while before they can come back and start asking questions. And then educational materials produced according to the need of the tribal community. And there are some outreach materials through the CMS, Tribal Affairs, that provide specific, and they you can also put your information, your contact information on there. So when you're doing the outreach, um, or even just trying to give information out to your tribal members, you can have that made. So a lot of these enrollment sisters, what they were doing is that they were utilizing that and handing that out to their tribal members so that they have some sort of professional looking material that they can hand out to their tribal members. And then through these site visits too, I would find out how they focus on uninsured groups. What do they do? How do they make sure that they're, focusing on the individuals that do need health insurance? And so there's all sorts of ways that they would do this, not just the uninsured, but also individuals that maybe have private health insurance. And usually private health insurance only pays a certain amount. They don't pay the 100%. And so they're looking for that group also. And then I found out that there's a lot of, challenges and barriers that also vary throughout as I did this site visit. And that also helped me to understand, what was happening within each of the location, so that if they need help on a national level, that we're able to provide some of that information to them. And ultimately, throughout all of these site visits that I did, and each one of these facilities that I visit, you could see that each of the enrollment assisters, they were hard workers. They were passionate about, getting their individuals on health insurance, on, making sure that they were aware and had that information to be able to understand that health coverage was something that they should be looking into. And then the other thing is PBC screening. So, so what I realized about this is that the PBCs, they screen individuals to see if they need health insurance, and then being able to find out who's uninsured, who's being referred out. A lot of time the PBC are the one that need to make sure that the tribal members have some sort of alternate resource, so that, if they're only direct service eligible, that means that majority of the time when they get referred out to a specialty, then, they either have to pay out of pocket, and, maybe sometimes the tribal member will not want to do that. So PBCs get to screen these tribal members to make sure that they have some kind of alternate resource. And so they're looking through and making sure that the patient is screened for that, and if there's any way that they can help them and be able to maybe start their application process in the meantime. And then one of the best practices was that they would do a checklist for a patient. So every patient that comes into the facility, maybe for an appointment, or maybe it's through ER, maybe it's through urgent care, or maybe another clinic, that the patient goes to one location and they check in, no matter what it is that they're there for. And that location is the one that gives them a checklist of, all the places that they need to stop by. And the patient benefit coordinator is one of the stops. And so, as the patient is going through all this process, and each individual that is check marked for them to see, they have to get a sign off by somebody in that department. And then as soon as it's all signed off on, then they go back to that same location they checked in at to bring that checklist back, and so that they can be checked out after that. So I thought that was a really good tactic within that facility, that they made sure that the patient does get screened and are able to see all the individuals that they need to before they leave that clinic. And then next slide. So the other one is Medicaid retention. So a lot of times, the tribal facilities or the IHS or even the urban side of it, they're trying to make sure that their patients stay on Medicaid. And so they're coming up with all different ways to do this so that they don't fall off and then they have to come back and redo the whole application again. And one location, actually, what they did is they prepared pre-filled Medicaid renewal applications, meaning that all their information was already in there. So there's only certain sections that, that they would need to make sure that the patient acknowledged or gave more information. And then, giving them that information that, you just need to come in, take a look at this. We just need to update a few things, and then that's it. And a lot of times they don't have to even submit documents again, and then they just sign the renewal application, and then they fax it in for them, and that's it. So I thought that was a really good best practice for Medicaid retention. And then also, they would mail patient reminder letters to renew Medicaid. A lot of times, they realize that their patients, when they get their renewal letters from the Medicaid office, the patients were not opening their mail. But if they got a mail from the clinic, which they're familiar with, they would open that mail instead. So they would run reports so that they could see which patient it was time for them to renew their Medicaid application and send a reminder letter. And then providing, this one was actually coming out of California, this patient benefit coordinator. She was trying to find ways to keep her patients on Medicaid, and it was taking a lot of time for her to not renew, but to redo the whole application. And she was saying that it would take sometimes 2 hours, depending on how many are in the household. But the renewal process would take, less than 30 minutes sometimes. So she decided that she would do gift baskets on a monthly basis. So anybody that renewed their Medicaid application on time and within that month, then she would have a gift basket as a drawing. So this has been working very well for her, and she said she was the only PBC there. And once she started this best practice, then her rate went up, and she said that she was at 99% of Medicaid retention, which I thought was phenomenal. And then the other best practice is partnering up with community health workers, such as the public health nurses, the community health reps. And the way they use these individuals is that if they realize that maybe there's a patient that got referred out or maybe just got released from admission, and the patient needs to get on some kind of health insurance or maybe even do the Medicaid application, then the patient benefit coordinator would contact the public health nurse if they're going to see this patient, so that they could give them some materials to explain to them that, they could either come to them and do the application for them, or if they want to come to the office and bring all the documents so that they can start that application. And this helps a lot with getting the information to the patient as soon as possible, because a lot of times they want to make sure that, and they could be PRC eligible, which is purchase referred care also. So this was really a partnership between the community health workers and the patient benefit coordinator. Next slide. And the other best practice is using reports. So the patient benefit coordinator would print these appointment lists, and that's how they would look and check to see who is uninsured or maybe is insured but is not 100% insured. And so they would go through it and they would prioritize to see who is the one that are, maybe uninsured so that they can at least focus on those individuals. So this was the patients that were coming in that had appointments, and that's how they would print their report. And then the other part is patients, depending on what their ages were. So 0 to 19 years of age. So in that group, they would run these reports to make sure that, which patients are the ones that need to apply for health insurance. And the same for 19 to 64, and then also from 64 to and older, which could be Medicare age also. And then purchase referred care case manager list. This was pretty interesting that the way the patient benefit coordinator would also partner with the PRC case manager to find out which patients, have a lot of bills or maybe currently is admitted and they know that the bills are going to be a lot. So what they would do is work off that list also to see if they can, target these individuals to start their some kind of alternate resource application for them. Next slide. And then the pharmacy research. This was pretty interesting. This was quite new to me this year coming across this, and there was a lot of facilities that were going this route. So they were starting to identify patients that had Medicare Part D, but they were on the wrong plan. And so what they started doing was that making sure that, especially the ones that have high cost prescriptions, and they started using this Medicare drug tool finder. And since they get seen there at the facility and they have a list of their medication, they would take that medication list and input it into this drug tool finder. And through that, it displayed like the top 5 plans that would show that that plan is the one that covers maybe a majority or maybe all of it of their prescription that they were getting at that facility. And once they got them on the right Medicare Part D plan, that was bringing more revenue into their facility. And then for those that don't have any kind of health insurance, but they had some high cost prescription, and what the patient benefit coordinator or even the pharmacy techs were doing also was looking at this website, which is what this does is the assistance program is that it looks at some of the pharmaceutical companies that might be able to maybe reduce the amount of the pricing of the drug, but there's a list, and I added this link here to show that that's a possibility to look into also. But I thought that was pretty neat that they were thinking out of the box and looking at other ways to bring revenue back into their facility. Next page. And then tribal sponsorship. So there are some places where they're doing tribal sponsorship. And in this one facility, they are doing assistance for the Medicare Part B and Medicare Part D, and then the marketplace insurance plan. So they're paying for their premiums on 3 of those programs. And they started out with just Part D, and then they went into the marketplace plans, and then they're now doing the Part B side of it. And the more I talked to them about it, and they were very happy with the return of investment that they had received from doing just the tribal sponsorship. And they are also a state that did not expand Medicaid. So, and a lot of the individuals that they're helping with through the marketplace insurance plans and paying for their premiums was actually helping them and bringing a lot of revenue into their facility, and they saw this huge increase. And it also not just it also provided, equipment and also invited or increased their staffing on that end of it. So those are some best practices for that I'm sharing with you as I do this job. And then so going on to how all this best practices is helping the tribal communities and what the patient benefit coordinators are doing and how they are helping our tribal members and explaining to them what the value of health insurance is. And there are some visuals that they provide to their tribal members, and a lot of times our tribal members get seen at a tribal facility or an IHS facility and they don't get any kind of bill. So they don't realize what is paid for them because they don't see that bill. So what some of these individuals or these patient benefit coordinators were doing was that this is how much an ER visit costs. This is how much, a hip replacement costs. So they were giving them these visuals of what it would cost, if they were to get a bill, so that they can visually see why health insurance is important and why they should even look into it at all or even enroll into it. And then, there's all these years we've been educating about, health insurance. You need to get enrolled or you need to find some kind of a alternate resource. And they're getting to the point where they're starting to understand that. So now that they're on a health insurance, some of the questions they're getting back is, I got this card, but it has so much information on there. What does this mean? So some of the PBCs, what they've been doing is they've been photocopying some of those health insurance cards and taking all the PII off of it and then showing it to the individual, letting them know this is what you qualified for and this is what you're approved for, this is what your medical health insurance is going to look like, and this is all the information that's on here. And it was pretty interesting to see how they would provide a lot of information to their tribal members. And then also sharing the health insurance marketplace summary of benefits up front so that the individual would understand what kind of health insurance that they're enrolling into through the marketplace side of it. And then also sharing preventive services. So it's gotten to the point now that they're asking about health insurance, the cards, they're asking more information about deductible, co-insurance. And then so now they're looking into the benefit side of it is, what is a preventive service? So they're sharing these visuals, and CMS outreach materials also has some, I think it's a fact sheet that they have that is a list of preventive services. So they're sharing that information. And then the other thing is that in order to educate and to show tribal members why and how important health insurance is, that they're sharing stories from previous patients about something that had happened and how health insurance had helped them. And so those stories are really beneficial and help to understand and give some sort of information to the patient that's looking into health insurance. So here are some outreach and educational materials that are provided through the CMS Tribal Affairs. And there's tons of it. There's all sorts of categories. There's even all sorts of ways of brochures. There's pamphlets. There are folders. And that's the other thing is tribal members are saying, when I go to a private facility, they always give me something and I walk out with something. But when I go to my IHS or a tribal facility, I never get anything. They don't give me anything. But if you take a look at this, the one that says important facts about CHIP, this is actually a folder and it has all 4 of the CMS programs. And inside of it, you could give this folder to the individual that the patient benefit coordinator is helping, so that you'll understand that they might not read it right then and there, but they're able to take it with them. So that is an actual folder. And then next slide. So other materials that are out there, NIHB has all these materials also for tribal enrollment assisters or the patient benefit coordinators at the IHS facility. And these are materials that are there that are free, and you don't have to pay for any of it at all. You can ask for as many as you want, or if you want only 5 of them, they can do that too. So, but a lot of the NIHB toolkits are online. If you go onto our website, you'll be able to see a lot of these toolkits and the videos that we provide, along with our brochures and posters. And we can send these out to you also. And we do have an elders toolkit that has the bingo game on it, which has been, I hear that a lot of the elders like playing bingo, so this is something that educates them on terminology. So NIHB is also doing a story banking campaign, and what I realized is that we don't have stories that help us to be able to communicate with other organizations, or to even share, how Medicaid is important, especially the expanded Medicaid, and giving that information, and to be able to say, these are inspiring, and not only does it help a patient benefit coordinator, or maybe even explain to another federal agency of why, maybe having these special protections and these special provisions for American Indian is really important. It's also something that can be shared with senators, as our congressional staff at NIHB does, is they outreach to the senators to talk to them about, why Medicaid expansion is really important, that it should stay within Indian country. And then next slide. So a lot of this, as I had explained, does the advocacy work. And then not only that, we love to tell stories as an American Indian and Alaska Native, and we want to record a lot of this history of how, at the very beginning, when Affordable Care Act happened, nobody really understood what health insurance is. And now at this point, our tribal members are asking us, so I got this health insurance card, what do I do now? What do I need to do? And how do I, use this now? So there has been all these stories that are happening throughout the history, and we just want to collect some of that. And so I just wanted to share some of the stories that I have accumulated so far. And this story is about a 21-year-old male that's going to college, who is covered under his parents' private health insurance, and he was admitted to the hospital while he was at school in another state. And he brought medical bills to the Purchase Referred Care office that his private health insurance did not pay. And the Purchase Referred Care requested that he apply for Medicaid in the state he was living in. It was a Medicaid expanded state, and it turned out that he qualified for Medicaid, and also he qualified for the 3 months of retroactive Medicaid. And Medicaid paid for what the private health insurance did not pay for. And then the second example is about a 59-year-old man, and he always used Indian Health Service Hospital for his primary need for medical services. And he moved away from his reservation, so he was no longer eligible for Purchase Referred Care. And he's also a veteran. He was eligible for VA and the Medicaid benefits due to his income. And the patient benefit coordinator was able to assist him with applying for Social Security disability. And he thought he was not eligible for any kind of government benefits because American Indian and Alaska Natives have Indian Health Service. So after he had this positive experience, he told his brother to see a patient benefit coordinator to see what he was eligible for. And so in this example, this is really good um, to realize that there are still some of our tribal members that think that they don't need to apply for any kind of other programs because, you know, they have the Indian Health Service, but not realizing that they could be eligible for other benefits too. And then this one is about, the next slide, is about a 66-year-old elderly woman who needed to be referred out for specialty care. She was not aware of Medicare because she never worked. Patient benefit coordinator was able to assist her with enrolling into Medicare, and she was also eligible for Medicaid cost sharing, which paid for her premium and co-payments. She became dual eligible. After her Medicare and Medicaid became effective, she was referred out and didn't have to pay anything out of pocket, and purchase referred care funding was preserved. So those are some of the stories that I wanted to share with you. And National Indian Health Board will have their national conference, which is the National Tribal Health Conference, and it's going to be held in Temecula, California. And we will be doing a story banking workshop at the conference. And there we're going to be sharing stories, collecting these stories, and using this so that we could use a lot of this to educate not only at the national level, but also at the area office, at the local level, and be able to share how Medicaid expansion is important, or how to keep the special protections and the provisions within the health insurance marketplace. So we want to get all sorts of stories. It doesn't have to be on Medicaid or the marketplace. It could be on private health insurance. It could be on CHIP or Medicare, just how it helps our American Indian and Alaska Native. And the last part I wanted to share were some resources. So a lot of times we're trying to find somebody that will explain maybe a part of the policy of the marketplace, or maybe even just the Medicaid side of it. We're looking for somebody that might be able to explain some of that. Or maybe you have a patient sitting right in front of you, and it's not a case that happens all the time, and it could be specific to that individual, and you just need to get some information. These are some resources that are at your disposal so that you can contact them, and one of them is the CMS Native American Contact. There are 10 regions within CMS, and in each region there is a Native American contact. There's a couple of them that have 2 Native American contacts in the region, but I provided the link here so that you can look in your state and which region you're in, so that you'll be able to contact somebody to be able to help you on that end of it. And then also there are state Medicaid tribal liaisons. They're all different. Each state does their things differently for the Medicaid side of it. So, but there are tribal liaisons that will be able to help you out also. And then there is a CMS technical assistance for enrollment assisters. This is not specifically to American Indian and Alaska Native, but there are some really good information and technical assistance that's available for you in this link here. And they have all sorts of newsletters. They have maybe webinars. They have, and a lot of them are recorded. So this is also a good place to get some information. And then the other place is the Indian Health Service. They do have a website specifically to the Affordable Care Act, and then there's lots of good information in there. But if you have a question specifically, it could just be anything, because a lot of times we all work together on a national level, and this is their email that you can, if you have any kind of health insurance questions, they'll be able to answer this for you, or they'll contact anybody that's that would be able to help out with that question too. So that's my presentation actually, and it's just giving you guys some information on what some of the best practices that are happening throughout Indian country. And back to you.
Thank you, Kristen. And if you would like to reach out to Kristen directly, her information is provided on the screen. Her email is kbitsui@nihb.org. To close, I do not see any questions. I thank you all for participating in today's webinar. We will be sending around an evaluation in the next hour or so, and we'll also have this webinar recorded and posted online early next week, in which we'll send out a link to our participants and to our general NCAI membership. Again, thank you all for being a part of this webinar and this webinar series. If you have any further questions, please feel free to contact me, Nicholas Courtney, Policy Analyst at ncourtney@ncai.org. Thank you and have a wonderful weekend.